Hi, I'm Dr. Lacher with Springhill Equine and the podcast Straight from the Horse Doctor's Mouth. Today we're going to talk about eye medications. This is something that we frequently need to do on horses, and it is definitely tricky. They don't just sit there and open up their little eyes so you can drop the drops in. So let's talk about a few things before we actually get to putting the eye medication in. There are several different kinds of eye medications we commonly use on horses, but this is our basic one. So it contains antibiotics. So the neomycin, polymyxin, and bacitracin are all antibiotics that work to help control bacteria in the eye, but they don't do anything for funguses. The other thing you'll notice is that's all that's in this eye ointment. It does not contain a steroid. The most common steroid that is in eye ointments are dexamethasone or hydrocortisone. If your medication says either of those words on it, or you have any doubts, you should call us or your regular veterinarian to find out if this is something appropriate to put in the eye of your horse. These medications, when they contain steroids, can cause a fungal infection to go buck wild real fast. So if you have doubts, do not put the medication in until you've talked with us or your regular veterinarian. So, without further ado, let's talk about how we put these in. So the first thing we do is we pull the medication out. If it is not cold outside, I like to keep these in the refrigerator. If they're a little bit cold, the goo doesn't goo out as fast, so it makes it a little bit easier. Next, I'm going to unscrew the top, and we have two ways. So first we're going to go over one way, and then we're going to go over our second way. Our first way that we like to do this is with a horse that we trust. So Gigi here is my horse. I know her very well, and I know what I can and can't do on her. So this is, again, going to be the method I use for a horse I trust, and I may go through parts of it before I go through the full thing. So I'm going to demonstrate the full way that we do it, and then we can talk about parts that we go through. So the first thing I do is I put a halter with a lead rope on, and as you can see, I have put my foot on the lead rope with a little bit of slack in it so she can pick her head up a little bit, but not a lot. The next thing I'm going to do, and if I have doubts about how she is, I'm going to unhook the throat latch, but I'm going to put my hand through here. Again, this is why I say this is for horses we trust and that we know really well. So I'm going to put my hand with the ointment through the halter. This gives me side-to-side control of the head. The next thing I'm going to do is take my other hand and go down the front of her face so that I can use that to pry open her eyelids. I don't need her eye wide open, I just need it open a little tiny bit, okay? So can you guys see how it's barely open? And then right there, I'm gonna squeeze my tube, put a little ointment in, let her close her eye, and she's gonna blink that right in. So a couple of things that you saw there. Gigi was really good, because she's a really good girl, which is why I will use this method. It is not something I ever use on a horse I don't know. So horses that we have in the hospital, not our go-to. I frequently use it on my own horses and talk with clients about interaction with their horses, and we'll go through it with them. The other thing you'll notice is that the tip of the tube never came near her actual eyeball. And that can be difficult on a horse who throws their head a lot, and that would be a case where this method would not be appropriate. So as long as the horse is good and they're going to let me do this where I can keep the tip of the medication away from the eye, then we're okay. So one of the things we worry about is taking the tip of this tube and basically bopping the cornea with it and causing more problems than we already have. So what do you do then in the case of the horse that isn't so good? We have what we call the fingertip method. So using a clean fingertip, I don't recommend gloves for this because gloves often have like powders and additives on them. So we do recommend that you just go with a clean finger. I'm going to come, typically I do it from the front and the side. I'm going to take a finger and pull down, and horse eyelids are really strong, and then I'm going to goosh that, goosh is a technical term, right into the corner of the eye. And I'm going to do a pretty good goosh on it, and I may then kind of rub the corner so that, again, she just blinks all of that into her eye. So there you go. There's two different ways to give an eye medication, one for one you know and one for one you don't. Did you like this video on eye medications? Make sure you subscribe. Right there, right there. Anyway, subscribe to our YouTube channel and get all of our videos that we do on horse care, as well as our seminars once monthly.